Destination Medicine is a collaborative initiative of regional training hubs. With first-hand lessons learned from those who have gone before, this podcast is designed to assist and inspire anyone interested in pursuing a medical career in rural and regional Australia. Welcome to Destination Medicine. I'm Peter Lance. After spending 20 years as a government ecologist, Stefanie Pidcock needed a change. She says worrying about the climate, both at work and at home, was taking too much of a personal toll. So she made a big move, from healing the environment to healing people in a rural setting. Now a GP registrar working on the New South Wales South Coast, she hasn't looked back and says she highly recommends rural internships with their high level of training in beautiful locations. Dr. Pidcock describes her journey, what she learned along the way, and her enjoyable new career to Nicole Goodman.
In 2014, I had reached a bit of a transition period in my career. I was working on climate change in the federal government, and I'd been working for about 20 years on environmental issues across the private sector, the university sector, and government. And I just had a sense of depression, despair about environmental issues and the gradual loss of all the things that I valued. And while I'm still passionate about those things, I felt that I couldn't really go on both working and being concerned about those in my private time as well. So I decided that I needed to have a career change, and medicine was kind of the next most interesting thing that I could think of. So I decided to go for it with the significant encouragement from my husband, who basically just said, just do it, leave work, go back to university and become a doctor if that's what you want to do.
Tell us a little bit about the intern application process. Did you attend any information sessions? And are there any resources that you in particular can point our listeners to?
Yeah, so when you're coming to the end of your medical degree, the interesting thing is that you're pretty much guaranteed of a job because interns are valued and needed as feeding stock for the medical workforce. So you will get a job somewhere. So your decision really is how do you go about applying to where you want to work, and that can be quite involved. Each of the states and territories have kind of tiered application processes. So if you have trained within one university, you have preference to do internships within that state. And the applications are really done at the same kind of time. So all of the graduating medical students are all applying for internships at the same time. So there's both state-based decisions that you need to make, but also decisions about whether you want to do a rural internship or a city-based internship. By way of information, each of the state health departments provide information to intern applicants, and they have sort of standard application forms. So in the ACT, where I was looking for my internship, my choice was either to do my internship at the Canberra Hospital, or we also provide interns to Bega Hospital, which is in rural New South Wales. So in addition to the standard internship application, we had to write an additional application stating our claims for wanting to do a rural internship, and we had to attend an interview. There are information sessions for intern applicants about how to put together your CV, and the university generally runs that for interns, and they provide reasonably good resources and advisors for you. So in every medical school, there is a rural clinical school, and the rural clinical staff are always fantastic to go to. Rural medicine is one of those areas that's in high demand. And if you're expressing an interest, then there are people readily available to really help you get where you want to go. So I'd really recommend talking to them.
Well, at the moment you're working at Eurobodalla Health Service. What led you to end up there?
So when I got into medicine at the ANU, I applied for and got into the rural stream So at ANU Medical School, you sort of go through an additional application process in first year medical school. You write an application and you're put through a series of interviews to apply to get onto the rural stream. And that allows you to spend your third year of medical school in a rural location. It's only a couple of hours from where my kids are at school and live. And so it's just practically enabled me to train rurally but maintain my family priorities of adolescent children wanting to stay within their friend networks. It's really fantastic. Lots of beautiful natural places to swim and walk, and yeah, it's great.
If we go back to the interview, was there anything that you think assisted you in being offered a placement or internship at South East Regional Hospital?
From the beginning of starting medical school, it was clear I had utter commitment to rural training and practice. I had form, so to speak, with having been on the rural stream, being a student representative on the Rural Hub Advisory Committee, and having a consistent message from the beginning of medical school that Bega was where I really wanted to train. And I did spend some time when I was at medical school and attending some of our rural clinical teaching sessions down in Bega, just to sort of form a few relationships and alliances to kind of shore up my attractiveness for doing my internship down there.
So what do you consider the highlights then of your internship or medical training so far?
You get to do a lot more than you do in an urban hospital. So I've done most of my placements in rural and regional hospitals, but I did do a couple of placements in the Canberra hospital. And I have to say, in comparison, when you're in a rural hospital, you get to do more than just walk around with a computer on wheels taking notes. You can develop skills, like I learnt how to do ultrasound-guided cannulation, putting PICC lines in, doing abdominal drains, all these sorts of practical skills that you need to be able to help patients. And because you're not kind of elbow deep in registrars, it's very easy to source somebody to help you learn those skills and then apply them. You also have quite individualised attention. You don't have vast numbers of interns or junior doctors who are all kind of sitting in a room with education. You're basically in a small group of 2 or 3 people, so you get very individualised support and teaching. The flip side to that is that you are quite an integral and important part of the staff in a hospital. Even though you're only 1 year out of university, you are heavily relied upon to be making clinical decisions, to do all of the tasks that doctors need to do, for the nurses to be able to do their jobs. So you're actually a pivotal part of that team. And it just means that you are expected to step up and take a lot of responsibility. My first experience, day one on the job in Bega Hospital, there wasn't a registrar on. I think the registrar was on leave. And so my first evening shift, I was the only hospital doctor on duty to look after all the patients in Bega Hospital. Happily, the ED doctors were still on duty in emergency, and when I rang them up to ask for help, they were all super supportive. Same with the intensive care doctor. So I wasn't unsupported, but it just meant that, I kind of had to really think about what had I learned in university and how was I going to apply this to a patient today on day one, which was both daunting but also a little bit exhilarating, really.
Yeah, it's that baptism of fire that you might not get in an urban placement.
Yeah, yep. Nobody died.
No one died, yeah. Thank goodness. My gosh. Yep. Moving from medical student to intern, what are some of the differences you've noticed in how you've continued your medical education?
So when you're an intern, you get a lot of formal teaching, and that's because that is a requirement for interns to reach full registration. But everybody kind of knows you're new and it's daunting and you've got a lot to learn. And so there's lots of senior doctors and nurses who are giving you guidance all the way. It's a year of consolidating your knowledge and applying what you've learnt and finessing your sort of application of that theory and also your communication skills with patients. And it is a fairly big transition period. You start out, you're in medical school, And as soon as you graduate, you get this sort of title doctor. And a lot of patients aren't really familiar with the hierarchy of doctors within the hospital. So, a doctor is a doctor is a doctor. So in their eyes, you can be the same level as your consultant, and they expect you to know what you're talking about. And particularly for someone like myself, I came to medicine slightly later in life, and so my appearance might have, I guess, led people to believe that I perhaps had more experience than I did. Luckily, the other benefit to that is that I'm a good communicator, and I have maturity to be able to interact with patients, I guess, in a slightly more mature way than some. But I guess that the critical thing is that you need to be able to communicate well, both with patients and with your colleagues, and you also need to identify when you need to ask for help and actually ask for help when you need it. Don't kind of battle on your own.
Extending on from that, what additional advice would you give to a medical student who's considering undertaking a rural internship?
Look, I would highly recommend rural internship for all of the reasons that I've stated, including opportunities to learn skills and interact with seniors that you don't get in city hospitals, because you are the junior doctor and you don't have to compete with lots of registrars for getting both clinical and theoretical skills that you need. I'd say just do it. You absolutely won't regret it. Not only do you get, in my view, better teaching and more individualised teaching, but you get to do it in some of the most beautiful locations in the country.
Tell us a little bit about what influenced the university that you went to undertake your training.
Having small children, having a family, contemplating moving somewhere else was a big thing. For anybody entering medicine, the general approach is you sit the entrance exam and then you apply to every university that offers medicine in the country. Medical school is hard to get into. There are thousands of people who sit the entrance exam every year and significantly fewer medical training places. Now, I was lucky enough to have 2 offers, one in South Australia and one in the ACT, where I lived already, where my house was and where my family was. So that really was what secured my choice. All of the medical schools are good. They all have to comply with basic requirements and accreditation. There's always argy-bargy around, hierarchy of university medical programs. But at the end of the day, whether you are a good doctor or a bad doctor is, I think, very little to do with the university you go to.
Let's talk a bit about mentorship. Did you have any mentors or significant influence over your journey? And if so, how has that helped you, do you think?
So I've had lots of people who have really boosted my skills and also boosted my confidence, all of whom have shepherded me through my education and my learning and provided me with really personal and inspirational support. They're always kind and encouraging. Medical training is tough. It's a marathon. You're constantly having to perform and display. It is humbling because, like everybody, there are times when you fail or you do something stupid or you talk before you think. And it's really important to have people to remind you that everybody's been on this pathway. We're all human. We all do make mistakes. And part of a high-stakes career like medicine is you need to be okay with that and be able to say, it's okay, I'm not going to be perfect all the time, but it doesn't mean that I won't be a great doctor.
Is there any piece of advice that you received during your training that has stuck with you and held you in good stead, do you think?
Yeah, the fundamental message is be kind to yourself and be kind to your colleagues. Not all of your colleagues will have been told that advice or perhaps will implement that advice. Medicine can be a fairly cut and thrust professional workplace, but if you just keep centred and remind yourself that, you need to be kind to yourself and you're going to be better off being kind rather than unkind to your colleagues, it will stand you in very good stead.
Steph, I know you're in the thick of it at the moment, but do you have a vision of yourself in, say, 5 or 10 years' time? Where do you see yourself and your family?
So our plans are to move to the south coast of New South Wales, so I'll be working there across GP and ED. But I'm also interested in adventure. So I have an adventurous spirit, which of course is one of the driving forces why I wanted to become a rural generalist anyway. And so I'd like to go to some adventurous places both in Australia and possibly overseas, do some time with the Royal Flying Doctors Service and perhaps a trip to Papua New Guinea. I've always been interested there also from a zoological perspective.
Let's talk a little bit about organisations or networks that you've been involved with that have supported you on your journey. Tell us a little bit about those.
So one of the key organisations I joined when I first started medical school was an organisation called Doctors for the Environment Australia. This clearly resonates with me.
In your wheelhouse, yes.
That's right. It was a great inroad to developing networks with doctors who share common values with me. And as a doctor, you kind of have a different access in terms of your voice to the public and your voice to decision makers due to the standing of medical professionals. So it kind of blended these two components for me really, really well. And my colleagues in Doctors for the Environment have just been amazing at encouraging me in my medical career and also keeping me engaged in action on, environmental protection and climate change. So they've been fantastic. I'm a registrar under the Australian College of Rural and Remote Medicine. They do training specifically called rural generalism, which is training within GP, but also having an advanced specialty skill. And this is on the basis of rural doctors having to basically work across general practice and in hospital settings for patient care, because you might be the only doctor for several hundred kilometres. And so you really need to be, in a sense, a jack of all trades. So my college supports my learning. They provide encouragement, education, training, skills, and a network of colleagues that I think are really important to overcome the challenges of being in rural settings. The Canberra Potter Society, just to remind me that there's more to life than medicine. I was quite heavily involved with them before I started medicine, and it's just you do need to maintain your interests outside of medicine, because medicine can become utterly all-consuming. You eat it, you sleep it, you breathe it, you're constantly thinking about the patients that you're seeing, you're working and you're studying. It can basically consume your every waking moment, and you do need to maintain connections with other things in life.
Tell us a bit about the challenges that you've met in pursuit of fellowship.
Fellowship training is just challenging, full stop. Whatever college you're in, fellowship training is hard because you're transitioning from being a doctor under supervision to an independent clinician. There's a lot of assessment. There's exams, there's logbooks, there's case studies, there's performance in front of other clinicians when you're taking a history and examining patients and, or doing procedures. You need to have these things all observed by senior clinicians and signed off. On top of that, you also need to do education courses, which are requirements for fellowship. All of these things cost quite a lot of money, and you actually have to travel, because one of the aspects of rural medicine is you have to do a lot of travel. There are some payments that you get from the government, so you do get some subsidies for rural practice from the federal government. Oh, and the Rural Medical Association also has some grants, and colleges have some grants as well that kind of help you with the costs, but there's still quite a big outlay. Generally speaking, your supervisors should be helping you get all of your college requirements, but sometimes it does just take a little bit of chasing, and you've got to always keep track. What have I had signed off? What do I still need to have signed off? And these things take time out of your day, but also your supervisors. But your employer does get paid well to have you as a registrar, so you are entitled to expect the training and support from them. But one of the things that I've found particularly challenging personally is that, having adolescent children who want to stay put where they are, for the last 3 years, I've had to work in a rural setting and then travel back home on my days off to spend time with my family. And that is a lot of travel time, and it's quite tiring when you're also trying to fit in study and, any kind of social life. So that's quite challenging. But, I guess the reward is working in the rural environments in the clinical settings that I've described. On balance, I think is worth it. Yep.
And along with that, tell us what you're enjoying most about your training right now.
I'm enjoying general practice, just the diversity, the interest, the conversations, the patients, the diversity of skills that I can apply. I'm just finding great fun. And I'm finding it fun, particularly in the most beautiful part of New South Wales, in my view, the south coast of New South Wales. It's breathtaking, the landscape around there, being able to just pop down to the beach and have a little swim. And I'm enjoying keeping my skills up in the rural hospital where, again, you're not crowded with doctors, so sometimes I'm the only doctor on, and it's both challenging but also has built my confidence that I can deal with emergencies and I can sort people out and I can get them retrieved if they need it. So it is confidence building. I've always got a senior doctor on the end of a phone, so I'm not left completely unsupported.
Yeah.
But I do have to step up, and I'm finding that, really good for my skills and also my confidence. So the best supervisors are those who just ease you through, give you guidance, don't judge you, but identify where you might need a bit of help and pick you up on that. I guess in terms of preparation, I've done some tutoring of medical students, which has been very useful in building my skills in that area. I do supervise some medical students who come in and they sit in my consult room, and, I give them the chance to lead consults and give them some guidance and, talk about how they've gone at the end. But also, being a mature age student, I have actually managed a lot of teams in the past in my previous careers. So I kind of have some of those base skills already. And I guess it's one of the few benefits that you have from starting medicine as a mature age student. And remembering, be kind to yourself and be kind to your colleagues.
Dr. Stefanie Pidcock, a GP registrar at Eurobadzella Health Service in Moruya, New South Wales. This is Destination Medicine. Thanks for listening. Regional training hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.